this is Jessica Damassa, and I'm here at HIC 2017 in the HISA Studio. I am here with Taz. Taz, please introduce yourself for everybody watching.
Hi, I'm Tasneem Islam. I'm a PhD candidate at Deakin Uni and a member of HISA.
Fantastic. So we were talking a little bit earlier about some research that you're doing, so tell us about the project that you're working on.
So I'm working with nurse managers and I'm looking at how they interact with an incident reporting system. We in Victoria know it as RiskMan. It's got different names in other states, but we all essentially as healthcare workers, we're all familiar with incident reporting systems where you log an incident once something has occurred, whether it be a near miss, some kind of harm, and even going as far as a patient death. So these all get reported. So what I'm looking at is how nurse managers use this risk management data, what they actually do with it, how they interact with it, and whether this information is actually meeting their needs, which is something we don't actually know about.
So what have you found in your research? I understand that you're at the results phase and you're writing up. So what have you found? What are some of the key takeaways?
So I've found that nurse managers are facing a lot of personal and organizational barriers. It's always already been mentioned quite a few times at HIC already that there's a lot of socio-technical factors involved. It's never a simple solution.
Sure.
But what I'm finding is not only are there personal competence barriers and confidence with using systems, there's also training issues. So the nurse managers don't really receive formalized kind of structured training, so they're not really aware of what the system can do for them. Another thing is because incident reports can be time consuming to submit and sometimes there can be errors, nurse managers are often having to spend a lot of time correcting this and going to different sources to verify the information in these reports.
Sure.
And that kind of leaves them with a degree of uncertainty about how much they can trust this data, how they can apply it. And, in some cases, the managers have had to even employ workarounds like actually keeping their own records and saying, well, at least I trust that, at least I know that's accurate and that's reliable. So that's really concerning. That's got to change.
What are some of their concerns about inaccuracy? Like, what are some of the things that they're worried is not true?
Well, the actual data to begin with. So if it's not, I guess it's definitely that principle of garbage in, garbage out.
Yeah.
So, you've got to make sure that the data you're picking up is accurate, reliable, and relevant, really. So it's about making sure that it happens. And look, the nurse managers are aware of instilling a culture of safety and educating frontline staff who are the majority when it comes to submitting these kinds of reports, that the data needs to be as accurate as possible. However, there's always going to be some that falls through the cracks, and that's what they're concerned about.
From your research, are you going to be able to issue any recommendations on what nurses or organizations can do to improve the quality of that data?
Most definitely.
Yeah, and what are you going to say?
Yeah. Look, I'm going to say that education and awareness is needed. User-centered design, very, very important. Okay. It's why I'm a big advocate for UX and why I love that it's got such a prominent presence at HIC this year. So I definitely would like to get people involved in the design of these platforms. They probably have in the past, but we just need more of a conversation, more of a dialogue, which is what my research has helped do. It's kickstarted that process and will help kind of formalize the current state of the system and give us a platform on which to improve.
Fantastic. Well, good luck to you pulling your research together, writing your report, and presenting it. Sounds fascinating, and it sounds like it has the tendency to be able to improve things quite a bit. So thank you so much.
Thank you very much.
It's been fabulous to have you here, Taz. Thanks a lot. I'm Jessica Damassa in the HISA Studio here at HIC 2017. We should look for this presentation probably at HIC 2018. Thank you.